As COVID tightens its grip on us, flu season also is out there. We know some people have both bugs, creating what's being called Flurona. It's popped up in Israel and Southern California, I should say. So how concerned should you be? Sarah Hammond, Ask a Doctor.
COVID-19 cases are still rising, and so are flu cases this year.
We have almost 100 folks with COVID within our system now related to COVID. So we also have some patients in the hospital who have some flu-related issues.
But now a case of Flurona in Israel has everyone talking.
Flurona is this, catchphrase or word for a concurrent infection with both the flu, influenza, A or B, and coronavirus.
The first documented case was in an unvaccinated pregnant woman whose symptoms were mild. But Dr. Thomas Carews, chief medical officer with Riverside Health System, says that's most likely not the only case of the dual infection because of the fairly severe flu season this year.
There have been folks since the fall and even early winter last year and now into this year who've likely have had co-infections.
And he says it's not common, but it can happen because both viruses are spreading through the community.
I do not think this is going to be a huge issue where we're going to get folks with both infections. I think it's mostly going to be one or the other, and they're going to be a small percentage of folks who are unfortunate enough to contract both.
And Dr. Carews says the best way to avoid getting the flu, COVID-19, or even Flurona is to follow those mitigation strategies we've been talking about since the beginning. Washing your hands, masking up, avoiding large crowds, and getting vaccinated. For 13 News Now, I'm Sarah Hammond.